So as such, it's kind of a fitting topic for me to talk about accelerated injury recovery. I'm with Neurosports Performance and Rehab these days, and let me tell you, a year ago I wouldn't be able to stand here without discomfort and pain. This technology has been around for the last 15 plus years and has been utilized by the elite athletes of the world as their secret weapon to accelerated injury recovery. You know, a number of players like Peyton Manning, after his neck surgery, was going to retire, and he's been with the Broncos for, what, 5+ years now. We've kept Shaquille O'Neal in the game 5 years longer than he probably should have been. The last 2 MVPs of the Stanley Cup, one of which was a goalie that had a hip replacement. He said, I want to thank God, my family, and ARPWAVE for getting him and keeping him in the game. And that's really what I want to talk to you about today, this amazing technology called ARPWAVE. It stands for Advanced Recovery and Performance Wave, and this was developed by some of the leading sports physiologists in our country. And what it does specifically, it is an FDA-approved, patented proprietary DC biocurrent that addresses the neurological origin of whatever injury you have going on. So whether that's a sports injury or a chronic type issue or some type of neurological or other type medical condition, we're able to go and find the root of the issue and address that. So instead of treating the symptom or the anatomical or physiological aspect of whatever's going on, we're able to go in and address the actual neurological point of origin. And simply put, if you think about your body and your muscles are like shock absorbers on a car. They're designed to not only support your anatomy, but absorb force. If for some reason those muscles aren't working correctly, that force is absorbed in parts of the body not intended to absorb it. Your ligaments, your tendons, your joints, and sometimes even your bones. Well, obviously when that happens, we have an injury. So what we're able to do is go in there and pinpoint the exact muscles that have failed, that have this scar tissue, and again, whether it's from a sports one-time acute injury or something chronic, we're able to go in there and pinpoint those, what we call neurological hotspots, and that's what we treat. So we're not treating generalities, we're treating very specific muscles. Once we've identified these muscles, we're able to break up that scar tissue by contracting those muscles neurologically 500 times a second. So just lambaste those muscles and bust that scar tissue up. It's going so fast you can't even feel it. I'm able to re-educate those muscles to perform correctly because again, they're designed to be those shock absorbers and support your anatomy. After we do that, we're able to get rid of any of those neurological compensation patterns that you may have developed. A neurological compensatory process could be just that clamping down of the muscles and decreased range of motion. An example of it is if I ask you to stand up nice and straight and look to your right for me. Instead of being able to look nice and straight, you bring a shoulder up as part of that movement. Obviously, that's not a normal movement, and that's what we want to get rid of. And then finally, we strengthen those muscles in more than the traditional sense. We strengthen them by working all the muscles, the protagonist, antagonist, and all the ancillary muscles, and we're building that muscle endurance so we don't have some muscles fatiguing, kind of prematurely. So really when we're thinking and we're talking about, I kind of outlined a little bit on the slide, the sport-specific injuries. Again, the acute injuries, obviously, very simple. We're able to come in there and address specifically what happened, the muscles that failed. Adrian Peterson, who's been in the news of late, who had a complete knee reconstruction, and that very next year came back and won the MVP of the NFL. So you read about him in a lot of blogs and they talk about knee surgeries as the exception to the policy, but what they don't say is that he was an ARPWAVE patient. Again, it was the secret weapon. So dealing with those sports-related injuries, come on in and we will diagnose you and find out what muscles have failed. Dealing with any type of chronic pain. I can tell you, I've been retired 14 years and I dealt with a lot of chronic pain. The old adage of pain builds character, that's bunk. What builds character is living and enjoying life. And being able for the first time to be able to stand without any kind of discomfort or sit for any length of time without any discomfort has been a change in my life. I had this therapy done a year ago myself, and like I can tell you right now, I'm able to stand here without any issues because they address the neurological origins. And mine was traumatic. I mean, I'm like the Encyclopedia Britannica of orthopedic injuries. Personal case study, number one, and I'm able to function correctly without any type of issues now as a result of having this therapy done because it addressed the root cause of what happened to me and got those muscles functioning correctly. We have some of the best post-surgical protocols anywhere, because again, what this does is this patented proprietary waveform immediately puts those muscles into the eccentric, the lengthened contraction form. And what that does is really important for those that have had ACL surgery, UCL surgery, any type of surgery, because it immediately takes the pressure off of that damaged area, off that ligament, off that tendon. Allows the body to heal, allows that range of motion to be more normal. You know, when you think about how your body heals, it's blood in, blood out. So as I'm contracting those muscles neurologically, you know, it's flushing a lot of blood in there. It's helping your body heal. So at the end of the day, you know, how we developed this, again, we are very fortunate to be the only ARP Wave clinic in the greater San Antonio area. And it's quite an honor and a privilege, because now it's my personal mission to get out there and introduce myself to as many people in this greater San Antonio area as I can meet. I'm very passionate about young athletes, keeping them from surgery, keeping them in the games that they love. Taking that athlete just that one step further, so you know the difference between a Division II or Division I school. If we can get them there, you know, we will. And that's really the core of my passion is helping, working with patients, working with athletes, working with young people, you know, preventing these injuries to result in a surgery that may end their career altogether, keep them from that school, keep them from that scholarship. So with that said, I'm going to be around a little bit longer, but definitely take a look at our website, and it is neurosportsperformance.com. And my wife is here as well today. She is Dr. Early with Hebner Chiropractic, and we kind of cohabitate. So she's able to address the anatomical and the physiological component, and I'm dealing with the neurological. So again, I'll be hanging around for a few minutes longer. If there's any questions, by all means, please come up and introduce yourself. I would love to discuss our technology with you. And thank you again for having me, San Antonio. It's been a pleasure. Thank you.